With the passage of HR1, also known as the One Big Bill, the federal government is going to require states to put in work requirements for people on Medicaid expansion by the end of 2026. But leaders with the Montana Department of Public Health and Human Services said they didn't want to wait that long to begin implementing Montana's community engagement requirements.
The department is wanting to proceed as quickly as possible.
On Tuesday, DPHHS Director Charlie Brereton and other leaders from the department addressed a legislative interim committee meeting. One of the major topics was how they're adjusting to the changes in HR1.
We're still very much in the process as a department of moving through the bill and figuring out the exact requirements that actually ended up in the final legislation.
But it's already clear the law means big changes for Medicaid. It's going to require recipients to confirm their eligibility more often. It will expand cost-sharing payments that some Medicaid expansion recipients will need to make, and it mandates people on Medicaid expansion work or do other community engagement 80 hours a month. Since 2019, Montana's Medicaid expansion law has already called for community engagement, but the state's never gotten federal approval to implement it. Brereton says DPHHS considers they have a legislative mandate to move forward.
We do not want to wait until CMS promulgates rules or issues sub-regulatory guidance on the new HR1 requirements.
The department is submitting a federal waiver asking to move forward with work requirements and cost sharing early. Leaders said they're still working on some of the details. For example, the state and federal laws have different rules for who should be exempted from the new requirements. DPHHS plans to release its full plans for the waiver next week, but they're already accepting public comment.
Members of the public, legislators, providers, healthcare stakeholders not only have an opportunity to weigh in on the draft waiver once that is issued on July 18th, but also to weigh in right now as we are actively drafting and designing that waiver.
DPHHS plans to submit their waiver request to the federal government in early September. In Helena, Jonathan Ambarian, MTN News.